name is Lauren, and I'm going to be your nurse practitioner today. It's wonderful to meet you too. How are you feeling today? A little nervous? What are you nervous about? The procedure itself? So that's understandable. You get a little bit of white coat syndrome. We're very used to that, yes. A lot of people do get anxiety. They get nerves, elevated blood pressures when they are around any kind of healthcare professionals. But know that you are in excellent hands today. Okay? And again, I'm your nurse practitioner. You'll be meeting your doctor here very shortly as well. We will be taking the best care of you. Nothing today is supposed to hurt. Nothing today is invasive. And from the moment you step foot inside of this building here today until the moment you leave is probably only going to be roughly 45 minutes to 60 minutes altogether. Your procedure itself is only going to take about 10 minutes or so. Okay. Alright. Well, I did want to go ahead and run through your history and physical, your H&P. Just learn a little bit more about your background. Make sure that I have all the correct information on file today, okay? Excellent. All right. All right, can you please tell me your full name, first and last? Excellent. And your date of birth? Okay, great. All right, and why are we seeing you here today, sir? Okay, and that was how long ago? Okay, about 3 weeks ago. So you had some chest pain, and you went to the emergency room, and they diagnosed you with angina, correct? Okay. Alright, well, we're going to be doing the stress test today to see how your heart can manage with a little bit of added stress before it either has an abnormal rhythm or before it seems that the blood and oxygen to the heart itself drops. Okay, so we just want to see what your heart is able to handle today. Okay. Now, today, sir, during your stress test, if you were to have any dizziness, any shortness of breath, any chest pain, chest discomfort, any pain in your arm, make sure you make us aware as soon as that happens, please. We want to make sure that we keep you safe today, okay? So let us know how you're feeling and what is going on throughout the entire interaction during your procedure today, okay? Okay, great, great. Alright, we want to see how the medications they put you on have been working. So can you please review with me which medications you are currently taking? Your metoprolol? And what is your dose? Great. Did you take that today? Okay, thank you. Alright, and what other medications, sir? The aspirin? Is it the 81 milligrams? Excellent, okay. And when did you last take your aspirin? Wonderful, wonderful. And I see here you also take Prozac, is that correct? Okay, and what dose is that? And you took that last night? Okay, thank you. Any other medications? You take Zantac, alright. Very good. And you last took that yesterday? Okay, thank you. Alright. You don't take any nitroglycerin, do you? No, okay. We just like to be aware before we do any kind of cardiac evaluation. And do you use any inhalers? You do? Okay. Just as needed. Okay, understood. Do you have your inhaler with you today? Excellent. They did call you ahead of time and asked you to bring it. Very good. you don't need to take that right now, but we are going to have you take 2 puffs of your inhaler right before the stress test begins. Okay, great, great. Alright, now I'm going to run through a bunch of questions to get your full medical history, okay? So just let me know if the following applied to you personally. Great. Do you have a history of diabetes? High blood pressure? Yes. Hyperlipidemia? Any issues or problems with your kidneys? Okay. So that would be a note too. Do you have any family history of cardiac problems? Your grandfather passed away from a heart attack. I'm very sorry to hear that. Was he on your mother's side or you're on your father's side? Your mother's side? Okay. Any other problems with your heart that we should be aware of? Nothing up to now. Okay. But you have been taking metoprolol for a little while. You've had high blood pressure. Okay, that is fine. And the metoprolol has been controlling that? Excellent, excellent, good. Do you take that every single day routinely? Good, good. You always want to make sure our patients are compliant. That is so important in being able to treat you appropriately. Okay. Any other breathing problems like COPD? Just the asthma? Okay. And sir, do you smoke? No. Did you ever? Okay. And for how many years did you smoke? About 8 years, okay. And you quit how many years ago? 10 years. Very good. About how many packs a day would you say? Less than 1? Okay, very good. Good. And do you drink alcohol? Yes, I love a drink every once in a while as well. About how many drinks would you say you have in a week? About 4 to 6? Okay. Do you have any sleep apnea? Not that you're aware of. Okay. You do have asthma. Have you ever had pneumonia? No. Okay. And what is your current height, sir? 5'9". Okay. And your current weight? Okay. And do you have any history of liver disease? Any hepatitis? And you've had angina now before. Alright, any arrhythmias the doctors ever told you about? No? Okay, good. Do you have any allergies that you are aware of? Penicillin? Okay. And what happens when you have penicillin? You get rashes? Okay. And have you ever had surgeries in the past? Okay. You had your gallbladder out? And what year was that, sir? Okay. Good. I've had my gallbladder out as well. It's an interesting recovery. Yes, it takes longer to recover than you might expect, right? I'm glad they got that out for you and you're doing well since then. Very good, very good. Any other surgeries? Okay, it was a complete? Okay, total knee replacement on the right knee. And what year was that, sir? Okay, good. Any other surgeries? None that you can think of? No wisdom teeth removal? You did have your wisdom teeth taken? Yes. Yes, that does count as a surgery. And what year was that? Okay. Okay. Excellent. All right, and who's here with you today? Your wife? And what is her name? And it's okay if the doctor brings her on back? Excellent, excellent. We just like to make sure ahead of time. And she's staying in the building? Good, good. Yes, we just like for the driver, the significant other, whoever is accompanying, to be on site, just so that we can have them handy should we have to speak with them about anything, okay? Nothing to worry about, just relax. Again, we're not doing any kinds of procedures today. You can just relax today, okay? Relax. Yes. All right, sir. And is there any reason why I cannot do a blood pressure on your left arm? Okay, good. We just like to make sure. And I'm going to go ahead and get your vital signs at this time, okay? Great. Okay, so this here is just a thermometer. It actually goes straight across your forehead, and that's how we can get your temperature, okay? Alright, just stay nice and still. 97.6, very good. Alright, and then this here is actually your blood pressure, okay? So this is going to go on your left arm. That's why I was making sure it's safe to put it on your left arm, okay? It's just going to squeeze a little bit. Shouldn't be too painful. Alright. Please hold your arm out for me. Very good. Alright. And like I've said before, just going to relax, okay? Alright, yep, and just relax on down. I just want to see where your baseline is at, okay? We will also be monitoring your blood pressure throughout your stress test today, as well as your heart rate and monitoring and EKG. So I'm just going to leave this blood pressure cuff on as soon as I'm done getting your initial vital signs. So just relax, okay? Excellent. Great job. Your blood pressure is a little bit elevated. It's about 155 over 92. That is kind of expected since you are a little bit nervous today and you do regularly have high blood pressure regardless, okay? But again, we will keep an eye on that to make sure you're still safe throughout the duration of your stress test examination today, okay? Alright, excellent. Alright. Alright, and if you wouldn't mind extending your wrist out, I'm just going to get your heart rate now, okay? So just relax. This won't hurt. Okay. Very good. I'm just going to watch here. Okay. very good. It's about 88, which is actually still right in the normal range. Okay. Alright. Now that your vital signs are done, I'm just going to go ahead and listen to your heart and to your lungs. So for right now, I'm going to listen to your heart sounds. I want you just to sit nice and still, breathe normally, okay? Just relax, relax. I'm just going to listen behind your back a little bit, okay? Good. Okay. And everything sounded great with your heart. I'm just going to listen to your lungs now. So I do ask that every time I set the stethoscope down, take a nice deep breath in, and then slowly let that breath right back out. Okay? No hyperventilating on me though. Okay. Okay. Breathe in. And out. Good. Very good. Very good. Alright. Heard breath sounds in all areas, so that is great. I didn't notice any wheezes or any issues or any dead zones, so to say, where we don't hear breath sounds. So that was excellent. So far, your examination is very well. That means that we can go ahead with the examination and the procedure today with the doctor. Okay? So what's going to happen now, I'm actually going to step out and review your history, your physical, and your examination today with the cardiologist. In a little while, he will be in to administer the entire stress test. I will be in here with you as well, okay? Now, while I'm speaking with the doctor, one of our techs is going to come in. She will get you all set up. She'll let you know where to undress. And then she will get you started up with some of the electrodes. These electrodes allow us to monitor your heart rate and your EKG all throughout the entire duration of the stress test, so we can see how your heart is handling the stress. Again, if you have any issues throughout, if you get shortness of breath, chest pain, any pain radiating down your arm, anything like that, please let us know so we can stop the test immediately. Otherwise, we're just going to be monitoring based on your blood pressure, your heart rate, EKG, and visually just how you appear during your stress test, okay? Great, yes. Now for the stress test, did the doctor or our nurse inform you that you will be on a treadmill? They did. Okay, great, great. I see you wore flip-flops, so I just wanted to make sure. We are going to have you try to run during your stress test. Your wife has your sneakers. Okay, you accidentally left them with her. That's not a problem. That's not a problem. We will make sure that we collect those before we get everything started, okay? Excellent. Yes, sir. Do you have any questions for me at this time? No? You think you're ready? Don't be nervous. Don't be nervous. Again, the doctor is going to be there. The tech will be there. And I will be there with you the entire time. Okay? We'll be keeping an eye on your vital signs all throughout. and I'll be right beside you. So if you have any questions, any concerns, any pain, anything that you want to tell me about during the interaction, during the examination, please do not hesitate, okay? Yes. So again, you're in great hands. We're going to take wonderful care of you, sir. I want you to just relax now, okay? The hard part is done. The worst part was when you went to the hospital. Today is just to monitor and to see how your medication regimen is helping you and see just where your heart is at. Today should not be concerning for you. Today should not be painful, okay? You're just here. Again, it's going to last about roughly 10 minutes, about 8 to 12 on average. And then everything will be all done and we'll let you know how everything looked immediately, okay? So it's really, it's a non-invasive type of procedure today. So just relax, have some fun with it if you can. See it as your exercise for the day. And you can let your wife know that, okay? So she doesn't get on you later. Excellent, excellent. So no questions for me at this time? Great. Then I'm going to step out again. If you develop any questions, I will be in there during your stress test. So you can feel free to ask me anything then. But I am going to step out now. I'm going to go touch base with your cardiologist. And in just a few minutes, our tech will be in here. And she'll go over all the preparatory work before the test begins. Excellent, excellent. Thank you very much, sir. It was a pleasure to have met you now. And I'll see you again in just a few minutes. All right.